Low testosterone is a disease that affects men most commonly later in age, in their 50s, 60s, and older. It's related to just the natural process of testosterone decreasing over time. However, it can be seen in men of younger age or men who have had different medical problems such as chemotherapy or some other diseases that affect their hormone levels. Testosterone is the male sex hormone. It's what gives people their libido, their sexual desire, but it's also important for bone density, make your bones strong and hard, insulin control, which is controlling your diabetes, and preventing metabolic syndrome. The symptoms of low testosterone include poor energy, especially in the afternoon, difficulty sleeping, reduced endurance when exercising, reduced work productivity, reduced exercise productivity, mental effects such as irritability, depressive symptoms, confusion, or short-term memory loss. Those are very general symptoms that can be associated with other diseases, which is why we want testosterone levels to be drawn, blood draws, 2 of them at least 1 week apart, primarily or preferably in the morning. Testosterone normally peaks in the morning and drops off through the day, so we want to see what the peak levels are. After we have our 2 low testosterone levels plus the symptoms that a patient has, there are different treatments for low testosterone. We can give you testosterone in forms such as a gel, a patch, an injection into the muscle, or pellets that go in the fat tissue underneath the skin. There's also a pill that can be used to kind of trick the body's sensing of testosterone so that it blocks how it senses the testosterone, and then the body thinks that there's a low level. It then naturally produces more of a trigger to make more testosterone naturally. So we're not actually giving you testosterone, but the body is making its own from trickery. You want to make sure that you see a medical doctor rather than going to your local, health food store. There's a lot of herbal treatments being sold out there, but we have no idea what's actually in that medication. There could be things that could be harmful to your health. So you want to make sure you're in proper medical care with somebody who specializes in treating low testosterone. There are advertisements out there for injections, but you really shouldn't jump right into injections. You should see a urologist to see what exactly your problem is, and you may not need injections right away. It may not be the source of your problem. A lot of times when you see somebody who's not a urologist for injections, they charge you a fortune when it may not be that expensive or it may not even be necessary. So you should come see a urologist, come see me, be happy to see you and talk to you.